followers, but you are not inviting them to come for this important session, do you think even God is going to be happy with you? Okay, do you think God is going to be happy with you? Thank you. Yes, this is what I'm talking about. Okay, Hannes, you are doing the work. I can see that. Yes, as a moderator, this is what you do. You just have to type these ones and you keep putting it in the comment section from time to time. Let's continue. Prevention of breast cancer. 1. To prevent or reduce your risk of breast cancer, when you get pregnant and you deliver, do prolonged breastfeeding. So number 1, prolonged breastfeeding. Everybody type it in the comment section. Prevention of breast cancer. 1, prolonged breastfeeding. Type it. I want you to always remember, the longer you breastfeed your child, the lower your risk of getting breast cancer. So the women here who give birth and you're like, oh, me, I can't breastfeed for a long time. I can't breastfeed for a long time. I want to do what? Lactogen and whatever. Let me ask you, your child breastfeeding for a long time, and then you not breastfeeding for a long time and you get breast cancer. Which one do you want? I understand that sometimes because of the nature of work and all that, but please, the longer you breastfeed, the better, okay? The better your risk of what? Reducing, the better your chances of reducing breast cancer or preventing breast cancer. So, prolonged breastfeeding. Now, my favorite part is coming. Who knows my favorite part? So fine. We've been doing this together. Denise, we've been doing this together. What is my favorite part? Let me see if you guys are with me. After a baby breastfeeding, what is my favorite part? Let me see. Because this is not the first time I'm doing a session on breast cancer. What is my favorite part? No, we are not there yet. We are not there at mammogram. We are not there yet on mammogram. The child is supposed to breastfeed. A baby is supposed to breastfeed for a long time. My favorite part, what is it? No, it's not about smoking. We the men, give the breast for us to suck. Let your partner suck the breast for you. As simple as ABC. Yeah? Let your partner suck the breast for you. Remember, we said prolonged breastfeeding, what? Prevents breast cancer. Some of you don't have baby. You understand? Last year, when we were celebrating the World Breast Cancer Day, that was one of the things we were promoting. Suck a breast. Suck a breast. So you are a woman here. You have the boobs, you don't have a baby, or you have given birth, but you are not pregnant, getting pregnant anytime soon. Allow us to enjoy the breast for you. Yeah? Let your partner enjoy your boobs. But, word of caution, if you give us the breast and we start enjoying it, whatever comes afterwards, me, I'm not part of it. Don't come and say, Dr. Felix, now you cause some. No. I am not part of it. Remember, please, I am saying this in a joking manner, but I am very serious. What is the essence of this? Just like babies sucking your nipple, okay? When they are sucking it, okay, they help stimulate and release other chemicals in your body, oxytocin, prolactin, and all that, okay? Those sensory impulses that are sent through the nipple, through the areola, through the ducts, to your other tissues. They stimulate BRCA genes and cause them to be more effective. Remember, BRCA1 and 2, breast cancer 1 and 2 associated gene known as BRCA1 and 2. Their normal function is rather to protect what? Your breast from the tissues from going into cancerous cells, okay, or developing cancer. If at any point in time, the impulses to them are not carried well, then they'll become mutated. Once they undergo mutation, instead of them protecting your breast tissues, they'll rather become carcinogens inside the breast. When you are breastfeeding for a long time, the impulses and everything that is sent, it enhances these BRCA genes to do their work well, right? That is that. The other thing is this, also your man. The reason why we say that let your partner enjoy the breast for you is that in the absence of the baby, the man sucking your boobs will also give you close to what the baby is doing. So the women here, my message is this: stop being stingy with your boobs. Allow us to enjoy the breast. We'll give you 2-in-1. We give you breast enjoyment, and we give you enjoyment down there also at the end of the day. One stone to kill two birds. And I can tell you, if you put your boobs in your partner's mouth, once you are doing that, be ready for the other match, because the other match, by hook or crook, most of the time, it is going to happen. It is going to happen for sure. It is going to happen. Don't say, doctor, we enjoying your breasts and then you developing cancer. Which one do you want? Answer me. Of course, I know. If you are not ready, who will be ready? So fine. If you are not ready, who is going to be ready? Guys, answer me in the comment section. You giving your breast to your baby to breastfeed for a long time, or you allowing your partner to breastfeed for a long time, okay? And then you not doing that and getting breast cancer. Which one do you want? Tell me, will you allow us to enjoy or not? Talk to me, look sharp, I see you. God bless you. Do you prefer breast cancer, or you prefer us to enjoy it for you to reduce or prevent breast cancer? Yes, of course, it has to be your partner. We are not saying that go and give it to some random person. Somebody you are with. Enjoyment is better. Exactly. Enjoyment is better. So please, this thing of, oh, I don't want to breastfeed, unless you have a medical condition that does not allow you to breastfeed, okay? Yes, enjoy la. We go enjoy them. We enjoy the top and enjoy the down in addition. Double enjoyment, okay? We are going to prevent breast cancer by giving it to you. So please, stop being stingy with your breast, okay? Let your babies prolong breastfeeding, okay? Also, let your partner, in the absence of a child or baby whilst you are waiting, let your partner be enjoying it, okay? Next one is cut down weight. We are talking about what? We are talking about prevention of breast cancer. If you put on weight, it increases your risk of getting breast cancer. Hello, Jesus. Hello, Holy Spirit. Hello, Holy Spirit. Yes, I am here. Holy Spirit is here. God bless you. Guys, have you given me a follow? Please, if you have not connected with me, this is the place you learn from a specialist. Make sure you click on my profile picture and give me a follow. Also in the viewers eye, connect with all these amazing people there, okay? Some of you buy data from morning till evening and you'll be roaming on TikTok. At the end of the day, you burn your data for nothing. Connect with me. Sorry. After that, click on my profile picture again. Go to my page. You see a bell at the top right corner. Click on it and turn on the notification to all. Set it to all right? This is where you learn from a specialist medical doctor. My name is Dr. Mawuku Felix. God bless you. Now, so cut down weight. If you put on weight, okay, this is also going to what? Increase your risk of getting breast cancer. So by prevention, please, you need to lose your weight. If you put on weight, make sure that you reduce your weight. Maureen, I see you. God bless you. All right. So take note of that. Stop smoking and stop drinking alcohol. Stop smoking and stop drinking alcohol. Stop smoking and stop drinking alcohol, because no amount of alcohol is good for your health. Okay, no amount of alcohol is good for your health. So stop drinking alcohol. Stop drinking alcohol. You are a man here, you are a woman here, you are drinking. Moderator, comment section off, please. Moderator, comment section off, please, kindly. Please, comment section off for me. Moderator, if you are here, comment section off. We are talking about breast cancer prevention. Breast cancer prevention. Currently, there is no safe alcohol. Even the red wine, if it is a teaspoon that you are taking and it contains alcohol, currently, based on research data that has been compiled for over 30 years, and for the first time in the history of WHO, on the 4th of January this year, WHO brought out this news item that no level of alcohol consumption is safe for our health. Canada, those of you in Canada, Canada has also released the same news item. And this is based on years, decades of scientific data. So even if you are taking red wine, those days when they say, well, little alcohol, it's causing cancer, it's causing other things. So please run away from that as well. God bless you. God bless you. All right. So stop drinking alcohol, and also by so doing, you reduce your risk of what? Getting breast cancer, or you prevent breast cancer as well. All right. So take note of that. Take note of that. Let's continue. The next thing is smoking. The smokers in the house. Let me remind you again. Let me remind you again that smoking has nothing good for you apart from destroying your kidney, causing lung problem and other things. Smoking will cause colon cancer, chronic kidney disease, cardiovascular diseases, and many other things that we don't want for you. So stop using your hard-earned money to buy sickness. If you're a woman here, you're a man here, you are smoking, your risk of breast cancer is also going to go up. Because of that, if you want to prevent breast cancer, make sure that what? You stop smoking as well, okay? Stop smoking as well. Now, the women here who like to abuse contraceptive pills, okay? Please, if you keep abusing hormonal contraceptive pills, they increase your risk of breast cancer. All right? Some of you, every month, you are taking Postinor and the rest, emergency pills, unprescribed pills, without any lab work. You don't know your hormonal level. You are using your own prescription to go and get hormonal-based contraceptives. All this, when you keep doing them, you can never prevent breast cancer, and you increase your risk of breast cancer. And therefore, by way of prevention, we want you to also stop abusing hormonal contraceptive pills. On this note, let's now go to what? Treatment. The treatment of breast cancer will depend on the stage. Okay? We have grading of cancer and staging of cancer. When we do a biopsy, okay, when we do a biopsy, let's say this cancerous tissues here, when we do a biopsy of it, this one here, this brown thing you are seeing, the malignant tumor, okay, when we do a biopsy, meaning we take a sample of it and we go and analyze it under the microscope, the cells, the way they look, how they have changed from their normal appearance, okay, we call that the grade, the histologic grade. Okay, now, how far this cancer has invaded the surrounding tissues and also the systemic spread, we call that the stage of the cancer. So, grade and stage. The grade, Mrs. Versas, God bless you for the rose. The grade has to do with what? The cells, how different they have changed from their normal state, okay, or how much they have transformed. Okay, now we have spread. The stage is how far the cancer has spread. And when it comes to breast cancer, the treatment will depend on the stage, okay, the stage of the disease, right? So depending on your stage, I'm just going to lump things together because our time is up. We have to do some question and answers as well. So how do we manage it? We have what we call triple therapy, okay? Triple management or triple positive management for breast cancer, all right? Everybody, let's pour water for 1 minute. Let's share the live stream. Let's take the shares to 700. Let's go. I forgot, you may enter TikTok jail. If I'm talking, and I don't remind you to pour water, you may enter TikTok jail. Let me take some water also as of breast cancer. So as we've mentioned, the type of treatment will vary based on how far the cancer has spread, okay? How far the cancer has spread. Now, we have what we call the triple negative breast cancers. Now, look at how do I make it simple for you? look at breast cancer or a cancer cell as having 3 doors, okay? 3 doors. Whether a cancer will be sensitive to chemo or not will depend on whether it has a key that can unlock the door. The key here is the receptors, okay? The receptors that the breast cancer expresses. If the breast cancer expresses a particular receptor, we say that it has a key to unlock it. Those type of breast cancers, they will respond to chemotherapy. So we have what? Triple negative breast cancers. What is triple negative? Negative means that the breast cancer is there, but it does not express any of the surface receptors, and therefore most likely they are not going to respond to chemotherapy. There are 3 main receptors that they express. One of them is estrogen receptors, okay? Estrogen receptors. The second receptor is what? Progesterone receptors, okay? Progesterone receptors. Triple negative, yes, triple negative breast cancer. I'm just explaining the concept to you. Triple negative. Every breast cancer, okay, they express some surface receptors. If at any point in time we test this cancer and it's not showing signs of those receptors, we say that that breast cancer is triple negative. If it shows those surface receptors, we say that it's positive. The positive ones respond to chemotherapy, okay? Now, so the receptors that are good, that show that your breast cancer will benefit from what? Chemo are estrogen receptors, progesterone receptors, and then we have the HER2 receptors. Human epidermal receptors, okay? Human epidermal receptors, estrogen receptors, and progesterone receptors. If your breast cancer does not express them, we say that this breast cancer is triple negative. Most likely, it will not respond to chemotherapy. If the receptors are there, it means that the key is there to unlock it so that the chemo can enter the breast cancer tissue and kill it. If it does not express it, then it means that even if you put the person on chemo, because it cannot unlock the breast cancer, it cannot kill or destroy the cancerous cells. That is the concept of triple negative and triple therapy. Progesterone receptor, estrogen receptors, and then HER2 human epidermal receptors, okay? Take note of that. Now, if the cancer is sensitive to those receptors, then you benefit from what? Chemo. This chemo can come in 2 forms. Sometimes the breast cancer has spread so much or the lump is so big, so we can put you on the chemo before surgery to reduce the lump and also mop up the systemic spread or reduce the systemic spread. All right, so take note of that, okay? We'll put you on the chemo before surgery. Also, after surgery, okay, the type of surgery that we'll do also depend on the size and the local spread of the breast cancer. Assuming like this one, this particular type here, which you are seeing here, this particular one, right, with the malignant thing. If we do the investigation, the systemic evaluation, the CT scan, sometimes MRI, the hormonal issues, and realize that you don't have systemic spread, we can do what we call a lobectomy. Lobectomy. Ectomy means removal, okay? Lobectomy. So lobe removal, okay? Remember I told you that the breast has lobes or lobules. So if the breast cancer is limited to a particular lobe and it has not spread around, then we do local excision, okay, of the lobe. Exactly. The word is lobectomy. Bella Bay, keep up the good work. Very soon, I'm going to make you a moderator. You are doing so well. God bless you for that. God bless you. All right? God bless you. Yes. So if the breast cancer is confined to a particular lobe and it has not attacked the surrounding tissues, then we are going to do what we call a lobectomy. These yellow things are lobes. When we do removal of the lobe, then we call that a lobectomy. And that is indicated if the breast cancer is confined within just one lobe and all that. Now, that is that. Then we can also do what we call radiation therapy. Radiation therapy. Radiation therapy. Radiation therapy. Where we focus a beam of rays, okay, x-rays, but normally they are high doses, high frequency, right? We put it to it and then we focus it on a particular area to kill it. This radiation therapy, we can use it as a primary treatment or after surgery to reduce recurrence. Sometimes you do a lobectomy, but during the surgery, you feel that the tissues there, some of them has been infiltrated. Okay, so we can focus x-rays at that area just to reduce the risk of recurrence and also the leftovers. All right, so take note of that. So radiation is also another thing that we can do. All right, we can also use the radiation treatment for early breast cancers. Breast cancers that have not spread and they are very small, okay? We can use radiation to just kill them and then we fry them off, and over time you develop fibrous tissues, but from time to time, sometimes they can recover. So take note of that. Sometimes also we can combine what? Surgery with radiation, mastectomy with radiation. We do mastectomy. Currently, the trend is to go towards breast conservation surgery. However, if the cancer has spread or metastasized so much, then you are going to lose your breast, or it has attacked all the breast tissues, then you are going to lose your breast. There we do a mastectomy. But don't worry, even when the breast is removed, what is going to happen? We can do give you some prosthetics, okay, shaped like a breast, and then you put it on and put on your bra, and people outside will not know that you don't have a breast. It's only your partner or people around you who may know. So don't think that once they take out your breast, you are going to lose your feminine and all that. We can still give you some prosthetics, okay, to shape like a breast and then to give you that feminine appearance. So we can combine that. Sometimes we combine surgery, okay, we combine with surgery, chemo, and radiation. All of them will depend on the stage of the disease, okay? The stage of the disease, in other words, how far the disease has spread, right? So take note of that. Now, the common question is, what is the survival rate of breast cancer? If you have breast cancer, what is the survival rate? Whether you survive for a long time or not, again, will depend on one, your country of origin. And number two, the stage of the cancer. Country of origin and stage of the cancer. Everybody, if we don't take the life to 700, I'm going to bed though. Right now, let's go. I know you are doing well, but please share the live stream. Let's invite new people. Don't share the live stream to the same people over and over again. I beg you. Don't share the live stream to the same people over and over again. If you are here, you have not given me a follow. Please, can you give me a follow also? Click on my profile picture. We've been here for 2 hours, 22 minutes. And we have almost 20,000 views. People have passed through the live stream. Let's go, let's go, let's go, let's go. For WhatsApp, share the live stream. Give me a follow if you have not given me a follow. In the viewers, I make friends there also. Make friends there, make friends there, make friends there. Cindy Nice is there. Wish list is there. So fine for you is there. Breast cancer. That is why I tell you that if you have questions, relax. In my live stream, when I take a topic, I do it the country of origin. In advanced countries, because they have a lot of technology and then some medications readily available, patient can afford it, their health system is very strong, and health insurance and all that. Because of that, their patients survive better. Also, the country of origin in terms of technology, because of those countries, they have other technologies, they can pick it up early, right? If they pick it up early, then your prognosis in terms of outcome is also very, very good, right? So take note of that. Also, in the country of origin, another factor in the country of origin is this: breast cancer awareness, okay, varies from country to country. In advanced countries, sometimes when you get to a particular age, they'll be giving you a letter that you have to be coming for this and that and that and that. I'm going to take us through some of them, okay? So all those things influence the outcome of management, all right? The next one is the stage of the disease, okay? The stage, how far it has spread. Now, 5-year survival rates. Okay, let me not talk about this. For some reason, I don't want to discuss this online, okay? For some reason, I don't want to talk about the survivor rate, okay? For some reason. So I'll just do that according to the voice I've heard in my head. I was going to talk about how long can you survive based on the stage and all that. But the message here is this: you can survive breast cancer. Many people have survived breast cancer, okay? They've been cured. It depends on one, you picking it up early, you reporting early, and you working hand in hand with the doctors to what? Take you out of that condition. The reason why 90% of breast cancer mortalities occur in sub-Saharan Africa and in developed countries is this: because most of the time they report late. Breast cancer is, which list, God bless you. Woo, thank you so much. Breast cancer is curable. You can see. So you see, I am not giving you a fake info. Somebody is just telling her she's a survivor. But whether you become a survivor or not would depend largely on the stage of the disease. If you go and you're in the final stage, the disease is in the liver